I'm a speech-language pathologist and I enable people to communicate successfully.
Hi, I'm an audiologist and I help individuals to hear and comprehend comfortably.
Audiologists and speech language pathologists are one of the super specialists in the world.
Yes, speech language pathology and audiology is one such field which makes difference in people's life.
Nowadays, there is an increase in demand for speech-language pathologists and audiologists due to an increase in awareness of communication disorders.
The very first thing pre-university students or 12 students are concerned about is their career. Apart from conventional doctor, engineer, lawyer and scientist, there are numerous other options available in the field of service.
Speech-language pathology and audiology is a self-rewarding career choice full of scientific exploration, innovativeness, creativity, versatility, recognitions and opportunities.
WHO reports that 5.3% of the world has communication disorders. In India, the percent of communication disorders is 6.3. That means currently 8 billion population in India has communication disorders.
Apart from job satisfaction and personality development, this career choice gives you financial security and an opportunity to help people around you on a daily basis.
Now we will discuss if one chooses the field of speech-language pathology and audiology, what one can become and in which all setups he or she can work as a SLP and audiologist. With whom SLPs and audiologists deal, and educational programs one should undergo to become SLP or audiologist.
Speech-language pathologists work to prevent, assess, diagnose and treat speech-language, social communication, cognitive communication and swallowing disorders.
Audiologists work to prevent, assess, diagnose and treat hearing, balance, tinnitus and other auditory disorders.
SLPs and audiologists can work independently as lecturer or professor, scientific researcher, clinical speech-language pathologist and audiologist.
SLPs work in various setups. They can work in clinics, schools, educational institutions, hospitals, etc. They work across multifarious client population of varied age groups. They shoulder various responsibilities.
In many settings, SLPs and audiologists often work as part of a collaborative interdisciplinary team, which may include teachers, physicians, psychologists, special educators, social workers, physical and occupational therapists, rehabilitation counselors, etc.
If you like traveling, you can of course become an itinerant audiologist and a speech-language pathologist and explore different corners of the world.
We deal with the people of all age range from newborn to 100 plus. Children who do not seem to be speaking age appropriately go for speech and language therapy.
Children and adults can have hearing loss. Children have to undergo hearing screening at the time of birth, and then we do a complete diagnosis to find the degree and type of hearing loss. Both children and adults, after finding the degree and type of hearing loss, needs to be fitted with amplification device, either hearing aids or cochlear implant. And they also have to undergo rehabilitation program to understand speech and language in case of adults, and in children to develop speech and language. I deal with children and adults with cochlear implant. I do pre-implant diagnosis, screening, diagnosis, fitting with devices and post-implant mapping and rehabilitation.
Hi, I'm a researcher and I am studying the current technological options available for aphasia rehabilitation, focusing mainly on brain-computer interfaces.
Hi, I'm working in a pediatric hospital where I'm dealing with children having neurological disorders, voice disorders, fluency disorders, language disorders.
The work of an SLP is not limited to a population with disorders. This multifaceted profession allows us to work with artists of the theatre and help them with their articulation, dialects, etc. Moreover, for some movies, the guidance of an SLP
is taken to understand certain disorders so as to make the character on screen believable.
Hello, I'm Dr. Troy Clifford Dargan, and I deal with individuals with voice disorders, specifically singers and actors, in a field called vocalogy. We also assist professional singers and actors to maintain their voice quality by introducing vocal hygiene tips and giving voice therapy whenever necessary.
I am a speech and swallow specialist. I serve people with head, neck and related cancers, stroke, traumatic brain injury and progressive neurological conditions.
I'm a pediatric speech-language pathologist. I work in multidisciplinary education setup along with occupational therapist, physiotherapist, special educator and clinical psychologist to improve child's communication, social and personal behavior.
I deal with all kinds of hearing, balance and auditory related disorder. My area of interest is to diagnose and treat people having imbalance and dizziness.
In my setup, I deal with children with learning disability, autism, cerebral palsy, multiple disabilities or other syndromic conditions.
Speech and hearing professionals help people to communicate better and connect with the world. It's overwhelming to see the changes in communication patterns of the children and seeing them progressing in terms of speaking and understanding the language.
Happiness is when my patient smiles with satisfaction after the treatment.
I'm happiest when my young patients run into my arms for their therapy sessions and their parents report communicative success at home.
The entry-level course is known as Bachelor's in Audiology and Speech-Language Pathology. The postgraduate level course is Master's in Speech-Language Pathology and or Audiology. Further, you can pursue your PhD postdoc also. The basic requirement to get admission in this course is to complete pre-university or +2 with physics, chemistry, biology, mathematics or any other equivalent course in India.
Individuals with disability are not less than any, but they are differently able to cope up with their day-to-day situations. It's all about how you make difference in their lives.
I know I can make a difference.
Let's make a difference.
Let's make a difference.
Do you want to make a difference in people's life? Come, join us.